Well, radiation therapy is when we use radiation to treat patients with cancer following a prescription that was written by a physician. So the radiation is given to the patients to hopefully cure the patient. That would be the best goal, but sometimes a cure is not a possibility and the radiation is used to relieve symptoms. And sometimes it's used along with chemotherapy, which treats the entire body most of the time. And it can be used with surgery either before or after, but administering specific amounts of radiation to the patient. The radiation treatments can vary from one treatment all the way up to like 40 treatments. So it varies tremendously how many times a person is going to see a patient, but most of the time it's, 5 to 6 weeks of treatment that a person would see the patient each day.
So what is radiation therapy? Well, this is using high energy X-ray for the treatment of tumor cells while sparing healthy tissue. So this is a picture of a linear accelerator, and the actual X-ray beam comes out of the head of that gantry, and it's invisible. And it's much like radiography, except it's on a much higher level. We work in two forms of radiation treatments. One is external beam, and the other is something called brachytherapy. And I'll show you that in a second. Here's the actual picture of the external beam. We don't wear high-heeled shoes with a heel or looks like she's got some hose on with a skirt. We wear scrubs and we wear comfortable shoes because you're on your feet all day. This is actually a picture of how we use brachytherapy. So within each one of these, this is for cancer of the prostate, for example. This is showing an AP picture of it. And for each one of these needles that are in this area, they're actually inside the prostate gland with radioactivity. And this picture on the left that you see is an X-ray taken from the side or the sagittal view. And you can see these dots right here. This is a rectal marker. So we put this in the patient so we can determine where the rectum is. And then you can see right here, this circle, this is contrast media that we put into the urinary bladder so we know and can determine how far and how much dose these two critical structures in the body can receive. So we calculate everything based off of that. And here's another example of the brachytherapy sources. These are actually gold seeds. Can you see the seeds? These are also in the prostate gland, and these don't come out of the patient. They stay in the patient because the half-life or the radioactivity energy is 2.7 days. So once 2.7 days is gone, the patient is no longer radioactive. And there's very little dose to family members during that 2.7 day time frame, because the only thing the patient has to do is really, they can't put little children on their lap for 2 days. But it's an easy, knock on wood when I say this, an easy surgery for the patients to have. And 9 times out of 10, this cures the prostate cancer without really damaging other structures in the area.